Hello and welcome to DVB English News. I'm Nora. The regime's death toll from the devastating 7.7 magnitude earthquake, which struck central Myanmar on March 28, stands at just over 3,600. But according to DVB data, at least 4,346 bodies have been recovered, with 7,890 injured and over 210 still missing. The earthquake has affected more than 9 million people across 58 townships. Thousands of buildings, including hospitals and schools, were reduced to rubble. A trail of destruction has been left across Zagai, the epicenter of the earthquake, and neighboring regions of Mandalay, Magway, Bago, Naypyidaw, and southern Shan State. Mandalay alone reported the highest death toll at 2,788 bodies recovered. Towns like Chause, Wandrin, Thero, and Pyorbwe in Mandalay region have been left in ruins. Earlier this week, the UN resident humanitarian coordinator Marco Luigi Corsi made an urgent appeal to the international community.
Following the devastating earthquake in Myanmar on the 28th of March, response efforts are rapidly underway by the UN and humanitarian partners to address the massive needs we are seeing on the ground. The impact is far-reaching. Assessments are still ongoing, but initial reports indicate huge numbers of people affected and significant structural damage across multiple regions. High casualties numbers have been widely reported and continue to rise, with many hundreds, potentially thousands of people still missing as search and rescue efforts continue. People are in desperate need of shelter, food, drinking water and sanitation supplies, and mental health and psychological support. The public supplies of electricity and water is as of now completely unavailable across Mandalay City, the epicenter of the earthquake and one of the worst affected areas. Daytime temperatures soar about 40 degrees Celsius. Exacerbating health and protection risk, hundreds of families are spending days and nights in the open air, many of them sleeping on the roads. For some of them, their homes have been reduced to rubble. For others, they stay outside for fear of potential aftershocks. Humanitarian efforts continue with ongoing assessment, logistical and stockpiling arrangements, and emergency response in Mandalay and Sagaing regions in central Myanmar and southern east Myanmar. In Naypyidaw, UN agencies are working with others on the ground to carry out assessment and emergency response. Myanmar was already facing an alarming humanitarian crisis, and this disaster puts more pressures on already vulnerable people. An estimated 19.9 million people needed humanitarian assistance before the earthquake, and the disaster will only intensify these already severe needs. The UN Central Emergency Response Funds allocated $5 million towards the earthquake response, and others are contributing, but we need much more funding now. Additional resources are critical at this stage to ensure life-saving aid is delivered to those in need. We appeal to the international community to step up in this moment and support the people of Myanmar.
That was Marco Luigi Corsi, the UN resident humanitarian coordinator in Myanmar. According to DVB data, $138 million in international aid has been sent to Myanmar. The UN is requesting an additional $240 million to bolster its relief efforts. But Myanmar civil society and international experts accuse the UN of funneling all aid through the regime in Naypyidaw. It has been blamed for weaponizing earthquake relief by using it only in areas under the direct control of the regime. The UN has called for an immediate halt to all military operations and to prioritize aid delivery. Since March 28, the regime has continued its attacks nationwide. It announced a ceasefire from April 2nd to 22nd, following the National Unity Government unilateral 2-week pause on March 30th. A longer ceasefire, announced by the Brotherhood Alliance, will end April 30th. It opened an aid corridor from the border of China to Mandalay. But instead of focusing all efforts on earthquake relief, the regime is using this crisis to escalate attacks on resistant forces. According to DVB data, between March 28 and April 10th, the regime has carried out at least 152 air and artillery attacks. 90 attacks have taken place since its ceasefire began on April 2nd. This has resulted in the death of at least 113 people. The use of drones and paramotors, which are motorized paragliders that manually drop bombs, have been reported. The People's Defense Force, under the NUG, has also used the ceasefire to take control of territory in Zagai region over the last week. Relief workers on the ground in Zagai and Mandalay report the regime is blocking aid from reaching areas controlled by the resistance. An unknown number of people impacted by the earthquake are now living in makeshift shelters outdoors. Due to a lack of proper sanitation, clean drinking water, and food, an outbreak of skin and gastrointestinal diseases have been reported. 8 workers say cases of high fever, diarrhea, and vomiting are common, especially among children. The risk of disease has only worsened after unseasonal rains hit on April 5th, which washed over collapsed buildings where bodies remain trapped under rubble. Medical professionals warn that decaying bodies are releasing toxic gases and fluids, creating a public health emergency. Residents outside of urban areas devastated by the earthquake say they've received no assistance 2 weeks on since the earthquake. Up to 100 million kyats, or $22,000, is the cost to rent machinery to demolish homes damaged beyond repair. Clearing rubble costs an additional $4,400. With over 439 aftershocks recorded by the Thai Earthquake Surveillance Division and 113 confirmed by Myanmar's own meteorological department, the earth and people's lives remain deeply unstable. For DVB English News, I'm Nora.